we see so many clients come in that have made investments that they wish they didn't or they don't totally understand. And so Kathy and I feel really strongly that education is the key.
Welcome to Money Talk with Terry and Kathy, brought to you by the Spectrum Financial Group, serving individual investors and retirees. Our guest on this segment works with benefit consultants and employers to simplify complex systems and help them find the best way to maximize benefits and contain their costs. Sam Molnar is with Health Insurance Services Incorporated. The company is dedicated to navigating the high seas of the post-65 age group, healthcare coverage and pharmacy benefit management for employees of all ages. Sam brings consultants solutions that make them heroes to their clients and helps them win new business. Sam Molnar, welcome to the program.
Thank you for having me, David.
And I'll also welcome Terry Huber is with us as well.
Hi, Sam. Thanks for coming. Happy to have you.
Of course.
So, Sam, and I'm a complete newbie. You two are experts, so I'm going to ask probably the questions that some of our audience may be thinking about here. And you've done a good job of outlining some possible subjects to talk about. Much of it is very complex and confusing for so many of us. But employee-sponsored Medicare, what is that, and what would you like us to know about how that works?
Sure. Good question, David. The federal Medicare program is something that most people think of as a program for individual seniors. For, Uncle John or mom and dad as they turn 65, we think of Medicare as a program that they get into to cover their benefits. What a lot of people don't realize, and what many business owners don't realize, is that they can take advantage of the federal Medicare program to offer creditable coverage to their employees who are over the age of 65. And by doing so, actually offer their senior employees a better benefit and drastically lower the cost both to the company, to the senior employee, and actually to employees of all ages, because the benefits and the savings usually spread across the whole business.
Wow. In other words, any age group, or are there some selective sort of parameters around these ages?
Well, so only people who are over the age of 65 are eligible for Medicare in most cases.
Yeah.
But the way that the savings kind of distributes across the group is that I'll just tell you a story. Let me put it to you this way.
That's beautiful. Thank you.
So we worked with a manufacturing company in Brighton, Michigan. They had 70 employees, and of those employees, 4 were former partners who started that business and their 4 spouses. So 8 people out of that 70, a little more than 10% of that group. And this group of people was in their 70s and 80s. And because they were partners of the company, the way that their retirement was set up is that they were going to have company-paid benefits, healthcare benefits for the rest of their life. So they were on just a regular major medical plan without Medicare in place there, just your old Blue Cross Blue Shield. And by moving them to a employer-sponsored Medicare supplement, the program that we often use for small groups like this is called Premier Senior Health Plan. By moving them onto Premier Senior Health Plan, not only did the seniors get much lower premiums, a reduction from around $1,200 a month to closer to $500 or $600 a month, but the entire group got a reduction in cost by a third because those senior citizens were not on the group plan anymore, and they got a better rating from the insurance company.
Wow. And in that instance, had they just proceeded without doing this employee-sponsored program with Premier, of course, the company would have been paying more, presumably as partners. The company was funding that benefit for them, right?
Correct.
It saves all the way around. And in this case, I mean, they're getting older. They may have an exit strategy, certainly, but or a succession strategy, maybe better said. So this really just helps the total economic picture.
Exactly. And David, it's important for me to point out that the program also works for full-time employees. So while in that example I used some retired individuals, the program also works for people who are working full-time. They don't have to be retired to take advantage of Premier Senior Health Plan.
Interesting. But they would have to be 65 or older.
Correct.
All right.
And in Medicare. Correct.
Right. Got it. They're already in Medicare, 65 or older. They're working full time. They can still qualify, unlike this special group that were partners in the business, these 8 members that were in their 70s or 80s. Okay, cool. Got it. So this is and it's not widely known. I guess that's part of the sort of secret that you're uncovering here for our listeners, is that these are things that small businesses can take advantage of too, correct?
Oh, yeah, absolutely. The businesses that work best in our program are businesses with less than 20 employees.
Wow.
So really, your truly small businesses are the ones that we work with the most. And there was a small business in Virginia, and they had 3 employees over the age of 65 out of like 8 total.
Mm-hmm.
And by moving those 3, we reduced all 3 of those people. Their deductibles went from $1,000 a month to $0 a month, which means that they had no out-of-pocket cost to them.
Wow.
The company saved $80,000 in premium just on those 3 people.
Unbelievable.
It is. It's huge, right?
It is, Terry. I'm curious, is there a reason that less than 20 employees seems to be a sweet spot, as you mentioned?
Yes, there is a reason for it. And the reason is federal law, is regulations. So without going too deep into the details, I can kind of give you an overview. So, and this is, it's an important subject because it's something that I've been thinking about. Under the ACA, a small business under the ACA is defined as less than 50 people. Under Medicare, it's defined as less than 20 people. And that is not by design. That's simply an oversight of ACA to actually update what Medicare defines as a small business. And it's something that I think, I wish I had a lobbyist, because I think that this would be a really good solution for our country to save small businesses costs on their seniors and also bolster the Medicare program, which is such an important program. And we need more and more people in the Medicare program so that its risk pool is larger. So just to give you an idea of why it happened, in the 1980s, in the Reagan administration, Reagan was very focused on reducing costs to the federal government. Mm-hmm. And so Reagan passed a law. There's a package of bills called TEFRA, and I can't tell you what it stands for. I don't remember right now.
Okay. It's an acronym. It stands for something meaningful. Okay.
Yeah. And what TEFRA decided is when Medicare is primary, or when Medicare works for somebody who is a full-time employee at a company. And it says if you're a small business, you can take advantage of Medicare. But if you're a big business, you have to pay for your employees, right? A way for the government to save some money. And in that legislation, small business is defined as less than 20 employees. Now, we've updated the ACA to say the Affordable Care Act, or Obamacare, as some people call it, to say a business less than 50 employees is a small business. But for some reason, Medicare is still sitting out there at 20. And I'd love to find a way to change that. Seems like such a simple solution, good for small business, even good for people who are in support of a program like Medicare for All, because we're getting more people into the Medicare program, which is really the best health system that we have in this country is Medicare. You can see it really is truly. I wish I could get on Medicare. I mean, you can see 99% of hospitals in the country and 94% of doctors, and the government really watches the plans that supplement Medicare to make sure that people are protected.
Right. So the realignment of this definition of small business would then enable many small businesses that are not able to comply with the employee-sponsored program, they could get on board with it. Is that the thinking there?
Yeah, exactly. If it went from 20 to 50, think about how many more businesses would be able to take advantage.
Absolutely. So that's huge. That's huge. Terry, any questions or anything from your side?
No, I agree with Sam. It needs to be updated, and people need to look at that, because I agree, Medicare is the best thing going. I always tell people that turning 65, the best thing about that is Medicare. Finally, you get to take advantage of that. So I agree with what Sam's saying.
Excellent. And for those listening, if you're an employee, you're over 65, you're involved with a business with less than, we'll say 50 employees, this is something that should be on your radar right now. And hopefully the regulations will change around the Medicare definition of a small business. Switching gears here, there's this thing called self-funded pharmacy benefits. What is that, Sam? And again, why should we know about it? And how does this fold into all of this, the healthcare concerns?
So right now, in this country, if you get your insurance through your employer, if you get your health coverage through your employer, it's likely that you're also getting your pharmaceutical benefits, your drugs, your prescriptions through your employer's insurance company. And David, we could take a whole other podcast to talk about the mess that is the pharmaceutical industry right now.
But it'd be interesting to do that in the
way.
future. Absolutely, Sam. Sorry.
Maybe we could. So what's happening in the marketplace now is that most companies buy their pharmacy benefit management from an insurance company. They get it through the insurance company. Well, what a lot of business owners don't realize is that they can go direct to the pharmacy benefit manager for those benefits without having to go through an insurance company. And typically what we see with that is two things. One is a high level of savings for the same benefit.
Sure.
Sometimes 20 to 30% savings that you're getting back directly from the pharmacy benefit manager instead of through the insurance company, because the insurance company, they keep some of the money that's traveling through them that's supposed to go back to you. The other thing that changes there, David, and this is what's really vital, is that in the current situation, most organizations that are with their insurance company for their pharmacy benefit, we call that carved in. Most organizations like that, they don't own their data. Somebody else owns the data about what drugs they're buying, in what amount, how many of their members are using them. They don't know what their usage is. And when you go direct to the PBM, the data goes from being an asset of the insurance company to being an asset of your company. And then you can use that data to plan for the future and make sure that you don't get hit by really high prices, or if you do, you're prepared for that. I mean, one of the things that has happened in our country is that all businesses now have a health and welfare organization inside them. And you need data to run that organization. And so that's why self-funding, aside from the savings on your pharmacy benefit, is so important, is that you actually own your data.
Just a vernacular check, the PBM or the pharmacy benefit manager, who is that and where do they reside in terms of the structure of all of this?
Sure. Well, the structure, I'd like to draw you a picture.
A mind map, right?
You might have heard of some of these pharmacy benefit managers. Like Express Scripts was in the news recently because it was acquired by Cigna. Have you heard about that?
I didn't. Terry may have, though.
I did, yes. I did hear about that.
So what these PBMs do is they collect money from plan sponsors. So from any business, they collect money in premium dollars. And then they go and they buy drugs on a wholesale basis.
Oh, wow.
And then give that money to the pharmacy.
So it's like a buying group approach, isn't it?
Yeah, it is. I mean, it's a buying group, exactly. And the pharmacy benefit manager, it has as its customer either the business itself that is sponsoring the plan for its employees or the insurance company.
But it sounds like this is a much more efficient route if you go directly to your PBM. For all the reasons we know.
You take the insurance company out of the picture, and you just have your own direct contract with them. And that gives you, like I said, savings, your access to data. Data becomes an asset of the plan.
Right.
And frankly, it just gives you more control and more negotiating power.
Okay. Reminding our listeners, Sam Molnar is our guest. The website that you can find out more about the work he does, hismi.com. And you have another one here, too. It's pshp.net. His company, Health Insurance Services Incorporated. And we're with Terry Huber, co-host of Money Talk as well. So, Terry, did you want to take us anywhere else?
Yeah, I just had a couple things to say, and I think Sam mentioned this, but one thing that's really great about this program is you can have a group of one. And so I think a lot of businesses don't realize that this is available to them. And the pharmacy benefit managers is something quite new to people also. So I think it's really important, and that's why we do these podcasts to try to get this information out to these businesses, small business people that don't realize it's available to them. And Medicare is very complicated anyway.
Yeah.
And that's what we're doing. We're just trying to help people understand that this is an option for them. Correct, Sam?
Yeah. Exactly. Most of our customers in group Medicare are small businesses with, obviously less than 20 employees. But by small, I mean 2 people, a couple. that works together, or maybe 4 lawyers who have a very small partnership. And even with these really small companies, we can achieve an immense level of savings.
Excellent. So by group of one, as Terry mentioned, so I can be a solopreneur and opt into this sort of, or take this course, couldn't I?
Absolutely.
All right, beautiful.
You could be the only employee of your company and
could be a DBA.
Set it up for yourself through the company.
All right, wow, a DBA. Well, that's sort of fascinating. Okay.
I just wanted to mention too, and Sam probably mentioned this, but when you do retire or leave or sell your business, you can take this product with you, which is another really amazing piece of it, is you can keep it as you leave. So I just wanted to make sure that people knew that they could do that. And also, Sam, I wanted to ask you a little bit more about the pharmacy benefit managers.
Mm-hmm.
How do we go about helping people to go that route, as agents?
One of the big limiting factors in getting groups to move in this route is that sort of what we talked about on here is that people and business owners don't even realize that a pharmacy benefit manager is an organization that they are contracted with, whether or not they know it via their insurance company, and that by asking for their own contract, they can often get a better deal. I think there's a couple other big challenges that I want to touch on as well. Another one is, a big factor in this is that groups have to be willing and large enough. So on the pharmacy side, we're looking at groups of probably 100 or more. So businesses with 100 employees or even businesses with 50 or more employees are kind of what you're looking at, because they have to be able to buy their drugs on their own. So what we're talking about here is not buying insurance to pay for your drugs, but actually taking advantage of all of the discounts and rebates that are available through the drug manufacturers to just pay for your drugs on your own.
Wow.
To not buy insurance to cover those claims, but just to pay for them. And so you need to get a group on board with the idea that, hey, if you have 50 or more employees, you're large enough to predict your risk. You can buy some stop-loss insurance to cover it if it gets really large. But you're already paying such high deductibles that it often makes sense to just get rid of the idea of a deductible completely and pay your own claims on your drugs. And that's how you get access to your data and you start to know, here's what we can do. And so I'll tell you a little story that might be helpful for this. We worked with an organization that had a contract with a pharmacy benefit manager already. And we worked with them to bring them a more improved contract through a different pharmacy benefit manager. And they went back to their current PBM and said, hey, here's what we got, on this contract. We're thinking about moving. We just want you guys to know. And the pharmacy benefit manager came back to them and said, oh, well, we could do that. Sure. And we're talking about a reduction in price of hundreds of thousands of dollars. And they said to their PBM, they said, well, why wasn't it like this before? Why wasn't the pricing like this before? And the PBM's response was, well, you didn't ask.
Right,
oh my gosh.
Right. Wow.
So we really have to educate ourselves, right?
Right. So, and because, part of the reason why the cost of drugs has gotten so out of control in this country is that even the people who are supposed to be experts don't understand where the price is coming from. And if you don't know where the price is coming from, then it's extremely difficult to control that price. And so that's why our number one job is to educate both, business owners and the people who advise them on how to run the health and welfare section of their business.
Any follow-up to that from your side?
Yeah, I was just wondering one more thing, Sam. So what would your advice be for these companies that are 50 or more, say, what would be the first step for them to begin to look into this or make those changes?
There's a few things that they want to do first. They want to call their current consultant or broker and ask them about what would it look like for me to go self-funded or to go what's sometimes called partially self-funded, which is a little bit of less of a change. It's still insurance. Call their current consultant or broker and ask them, what would that look like for me? And if your current consultant or broker can't speak to that at all, then they should get a new consultant or broker.
Okay. Okay. So that's the first step.
Just look into being self-funded. And then, after that, It's a matter of trying to, look at your different options. One thing that's very important besides just saving money is that all of these pharmacy benefit managers that we all receive our benefits through the insurance company or through our employer, they have what's called a formulary. The formulary is a document that's published once a year that tells us what drugs we're entitled to and what drugs we're not entitled to under our program. And so we are all subject to a formulary. There are ways to get exceptions to them sometimes. But then what the company needs to do is, besides looking at the savings, they need to have someone who they're working with, whether it's, my organization or their current consultant or, someone like that, conduct a disruption report, which we can all do because we have computers now that can run spreadsheets very quickly and see, hey, if we change, how many of our employees are going to be affected? Who's going to have to change their drug, if anyone? And how do we manage that process? And a good organization, what we do at our organization is we look at every single drug, figure out which one would be the therapeutic similar if we are going to make the change, and have a pharmacist that works on our team talk to them. And if it comes to that is too radical of a change, you can always the other advantage of going self-funded is that you can add any drug you want to your formulary because it's your plan.
Interesting. Okay. That's so important to know.
Yeah, that's very interesting. So is that a service that the employer pays you for?
Yes. So the employer does pay to have these services done. Usually a typical administration fee, and it tends to actually go to their consultant, not to us, because it's their consultant who we're doing the work with, and it's their consultant who's bringing everything to them. Typically, we see an administration fee of between $1 and $5 per employee per month, and everything else is just wrapped into what they're paying for their drugs. They get, as they pay claims, they're going to pay to the pharmacy benefit manager, but not to us. And those services are all included before a group becomes contracted with us. That's part of what we provide to help you get to the path that we think that businesses should be on.
Okay, thank you.
So looking over the horizon a bit, there are some changes coming to Medicare, the Part D of Medicare in 2019. Did you want to talk a little bit about that?
Sure. So some of your listeners, I'm sure, are familiar with what is called the coverage gap, or often called the Medicare donut hole. And what this is so between $3,750 and $5,000 of total drug spending in a year, seniors are responsible for that range of expense, or the companies that pay for their drugs are responsible for that. There's no insurance coverage in there.
Okay, hence the gap.
Hence the gap, right? It is a gap. It's sometimes called the donut hole. In that gap, President Obama negotiated that prescription drug companies, the actual producers of the drugs, would pay for 50% of a senior's cost in that gap.
Wow.
So that reduced the seniors' responsibility by 50%. Well, starting next year, under the new budget bill that just passed, that 50% will go up to 70%.
Really?
Yep. So seniors will be paying another 20% less than they were before, or the businesses that sponsor seniors or retirees will be paying 20% less if they use Medicare Part D.
Wow. So, I was bracing myself and sitting down for some bad news, but the truth is that this is going to be a good thing. That extra 20% is going to help.
Yes. The only bad news, David, is that so Big Pharma is going to be paying an extra 20%.
Yeah.
Why would Big Pharma pay for anything that would benefit seniors? Because they're looking to avoid being regulated by the Trump administration in the future. So this is my opinion. I'm not any sort of insider in Washington, but what I imagine happened is that the drug companies acceded to this. They said, we'll accept this 20% increase, and in exchange, we expect to not be regulated.
Yeah, leave us
down
alone.
The road.
Right. Because there's a lot of tension between those parties, certainly. So yeah, in a way, well, look, everything's a negotiation, I guess. So it'll hit our pockets in a positive way. They'll be less regulated, which may have some spillover into some not so positivity, but it is what it is. But I really appreciate that point of view, because you asked the question somewhat rhetorically, and I couldn't come up with a good answer. And because you live in that world, you you understand those dynamics.
Yeah. Wait till I send you the mind map. That'll blow your mind, David.
I'll need a
Then
GPS to follow that mind map.
Not just oi.
Yeah, it'll be more than right. The mind map will require a very GPS. I think I can get Big Pharma to pay for my GPS too. Oh no, sorry. So what else, Terry? Did you want to? This is the end of the list of things we were going to talk about. But do you have anything else that you were thinking about? You'd like our audience to know that Sam may be able to unpack for us.
No, I think, Sam, you did a great job and really appreciate that. And, you know, we just need to really educate people that so many businesses don't understand this. And that's our job, is to get out there and help educate them and save them money. You know, and that's why we're doing what we're doing. And thank you, Sam, for sharing all that good information with us. You know, it's really important. So we appreciate that.
Absolutely, Terry.
Excellent. Sam Molnar. The company is Health Insurance Services and Premier Senior Health. Sam has been joining us to impart his wisdom and unpack the complex mysteries of Medicare and beyond. Sam, thanks so much for joining us on the program.
Thank you, David. And thank you, Terry, for having me.
Thanks for listening to Money Talk, brought to you by the Spectrum Financial Group, serving individual investors and retirees. Find out more at sfgnm.com. Investing in securities involves risk of loss to both profit and initial investment. No investment process is free of risk, and no strategy can guarantee returns. Discuss with an investment professional the unique risk-return profile of an investment strategy. Past performance is not indicative of future results. Registration with the SEC or a state licensing agency does not imply a certain level of skill or training.